This is Sarah Wiseman, and this is my Neuro Assessment. All right, occlude one nostril, breathe in. Other nostril, nostrils are painting. Occlude one nostril for me. Close your eyes. Tell me what you smell.
Toothpaste.
Other nostril.
Toothpaste.
Okay, close your eyes again. Occlude one nostril.
Peanut butter.
Occlude the other.
Peanut butter.
So patient can smell on both sides, so cranial nerve 1 is intact. The next one I'm going to do, okay, look straight at me. Okay, pupils are equal round and reactive to light. Pupils are measuring at about 6 millimeters bilaterally. All right, now look at this, don't move your head. Okay, so that shows me that cranial nerve 2 is intact. I want to do, hold out your arm. Okay, hold this card and read the smallest line possible.
LTFPH.
Okay, now cover one eye. Read the smallest line possible.
LTFPH.
Okay, close your other eye.
LTFPH.
Okay, so the patient has 20/20 vision in the right, left, and in both eyes uncorrected. All right, now I'm going to check for any extraocular movements or nystagmus, strabismus, anything like this. So don't move your head, follow this, okay? Eye movement was smooth. I didn't notice any extraocular eye movements, any type of nystagmus or strabismus. Okay? All right. The next thing I want to do is I want you, I'm going to feel right here. Okay. Can you clench your teeth for me? Clench. Okay. Can you clench? There you go. So I didn't notice any crepitus or anything like that. The next thing I want you to do is I have some cotton swabs. All right. Close your eyes and tell me where you feel this.
My cheek. My forehead.
Okay, close your eyes.
Cheek.
So the patient noticed the soft sensation wherever I put it, so he answered those appropriately. All right, so I need you to raise your eyebrows for me. Okay, can you frown? There you go. Show me your teeth. Puff up your cheeks. Okay, so the patient was able to do that appropriately, so it shows me that cranial nerve 7 is intact. All right, I'm gonna check your other cranial nerve. I'm gonna check cranial nerve 8. Close your eyes. Can you tell me which ear you hear that in?
Left. Right.
Okay, so cranial nerve 8 is intact. Okay, I have this. I need you to open your mouth. Maybe. There we go. Open your mouth. Say ah. Okay. Patient was able to do that. Now, my patient has a very sensitive gag reflex, so I'm not going to try to gag him. But that would be a good way to check if your cranial nerve 9 was intact. Well, in your gag reflex, I should say. All right, now I need you, I'm gonna put pressure right here. Can you shrug your shoulders against the resistance, okay? All right, and then can you turn your head against the resistance? Okay. Turn your head against the resistance. So the patient was able to do that. So that shows me that cranial nerve 11 was intact. Next thing I'm gonna check is I'm gonna watch, I've been watching him speak. Can you stick your tongue out? Side to side. Okay, now put your tongue in this cheek and try to push. Okay, so the patient was able to do that bilaterally without any type of problem, so that shows me that cranial nerve 12 is intact. All right, now I want you to do this on your lips, real fast. Okay, patient was able to do that without any type of problems. Now I'm gonna have you touch your finger to your nose and then touch my finger, okay? No, just finger, touch your nose, finger, touch your nose, finger. So the patient was adequately able to perform that exercise. Now I'm gonna need you to get down here, and then, so tap your feet on my hands, tap your feet, there you go. So the patient was able to do that. Now the next thing I need you to do is take your heel to your shin on both legs. Heel to shin, heel to shin. Go down. There you go. Other leg. There you go. All right. Now, I'm going to watch the patient walk, so hop up and walk that way for me. So I'm observing the patient's gait. Okay, walk back. Okay, when you walk this way, I want you to do heel to toe. So the patient performed that exercise adequately. There was no type of deficits in his gaits. He didn't have a shuffling gait, a Parkinsonian gait, or any type of issues while walking or completing that. So that tells me that his coordination is there. Okay, go ahead and have a seat. Okay, so I would observe the patient at rest right now and see if he doesn't look like he's in any acute distress. He's got, he doesn't have a flat affect or anything like that. He's dressed appropriately for the season and his age. All right, now can you hold your hands out for me? And at this point, I would observe for any type of tremor, any type of floating. That would be indicative of some type of like lesion, neuro lesion, or any type of stroke because you have that drifting. I didn't notice any of that. Okay, now I'm gonna do, if he had his clothes off and he was, or gowned or whatever, I would inspect his muscles and look for some symmetry. But, upon feel, all of his muscles feel very symmetrical to me. Okay, now, we're gonna do passive stretch. And I want you, just to let me, you rely on me. Okay. Turn this. Okay, other arm. I didn't notice any type of issues or resistance whenever I was doing that exercise. It was a smooth motion. Now I can't fully get down and do his legs just because of my surgery, but I would assess that for any type of, resistance with the movement or anything like that. Okay, now we're going to do a little game called Sharp or Dull. Okay, so tell me where you feel, close your eyes, and tell me the sensation that you feel.
Sharp. 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 Soft. Sharp. Soft.
So, on both sides, bilaterally, patient could tell or decipher what was sharp, what was dull. So that's telling me that that's intact. Okay, the next thing I want to do is, I've got this, my tuning fork. I'm going to check his dip joint and his IP joint. Okay, let me see your hand, please. Turn this way. Tell me if you feel the vibration.
Yes.
Okay. Tell me if you feel the vibration.
Mm-hmm.
Okay.
Yes.
Okay, other foot.
Yes.
Perfect. So the patient felt the vibration on all extremities bilaterally. All right. So, hold out your palm for me. Tell me what number I draw. Close your eyes.
4. 4.
So the patient was able to identify what I drew in his palms. The next thing I want to do is I'm going to do the 2-point discrimination. I have my calipers here, so he's either going to tell me if he feels 1 point or 2 points. Okay.
1. 1. 2. 1. 2. 1. 2.
So the patient was able to adequately identify that the 2-point discrimination. The next thing I want to do is I want you to close your eyes, okay? And I'm gonna touch you. Tell me where I touched you.
Left arm.
Close your eyes.
Right knee. Right arm. Left knee.
Patient was able to identify that correctly where I touched him. Then the last thing I want to do is I want to do where I'm touching you. Okay.
Left leg. Right arm. Left arm. Right leg.
Okay, so when I tested him for extinction, he was able to identify all of those. All right, now I need to do reflexes. Okay, so hold out your arm for me. Okay. All right. Where's the foot? Okay. Okay, so I noticed the reflexes whenever I tested his upper extremity and lower extremity. Okay, now if he was unclothed, wearing a gown, I would do the X on the abdomen to the umbilicus, but he is not. But I can't bend down too far to do the Babinski reflex. But if his toes curl inward, that's normal. But if they finger out, then that's a sign of some type of neurodeficit. All right, and the last thing that I need to do, oh, well, not the last thing. So in order to test if there's some type of meningeal disorder, then we could do either the Koenig or the Brudzinski. So the Koenig is you have the patient lay supine, you flex the neck, and if you notice that the knees or the hips flex, then that means that there's some type of meningeal irritation. Then you also have the Brudzinski, and that was when a patient lies supine, and you flex the hip at the knee, and if there's any type of resistance, then that shows that there's some type of, and straighten their leg, that shows that there's some type of meningeal irritation. All right, so the last test I need you to do. Can you extend arms like, or can you stop traffic? Out to the side, okay? Out to the side, okay? Now I need you to extend, do a straight leg raise. Okay, can you dorsiflex your foot, like bring your toes back to you? This one? Perfect. All right, now I need you to go ahead and go towards the wall. Okay, and I need you to put your arms against the wall, straight arms. Okay, and push against the wall. So I don't see any winging or anything like that when it comes to him pushing up against the wall. All right, thanks.